And good afternoon once again to everybody, and welcome back to IVF Navigator Live, together with medical doctor, fertility specialist, and chief medical officer of Fertil, Dr. Oybek Rustamov. Welcome back, Doc.
Hi, JC. Hi, everyone. Thanks for joining the live stream.
And again, of course, Dr. Oybek, as mentioned earlier from our previous live stream, will be discussing about step 25, cycle monitoring of stage 2 ovarian stimulation. Now, the IVF Navigator Live is broadcasted across Facebook, LinkedIn, YouTube, and other social media platforms. Those who are watching right now, you can also send us via a direct message at ivf-navigator.com or simply send a direct message to our official Facebook page at Fertile Official to tell us more about step 25. Ladies and gentlemen, let's welcome back Dr. Oybek Rastamov. Doc?
Uh, Thanks, JC. I will share my screen. Okay, so yeah, we're on step 25 of IVF Navigator. We're discussing cycle monitoring. So, as a part of stage 2, so the patient started the IVF cycle. Now we have to monitor the ovarian stimulation. First, we should understand why the cycle monitoring is important. Because the quantity, quality, and maturity of the eggs we get in IVF is by far the main determinants of success. So if you have a good number, good quality eggs, and with a good maturity, the chance of conception is much higher in IVF treatment cycle. So that's determined by a number of factors, which is related to the patient's couple themselves, a number of factors which is related to our decision making before we start IVF. For example, what protocol we choose, what drugs we choose, what dose of the drugs we give. Then also it's very dependent on our monitoring of the cycle. If we monitor the cycle carefully and we stimulate adequately and trigger a right time, then we should be able to get expected number of eggs, and is a good in terms of quality and quantity and also maturity. So that's why as a patient it's important to understand why we do the cycle monitoring, and also how we achieve that is important for you to understand and to navigate the cycle more seamlessly. So this why in this step we will cover why we do cycle monitoring and how do we do it. Okay, so there are 5 reasons why IVF cycle need to be monitored. So when we say IVF cycle, as you know, cycle starts with the first FSH injection. Let us say you had a full workup, you had a period today, and then tomorrow you start FSH injections. So which means your cycle started. So whole 10, 12 days of FSH injection is a stage of ovarian stimulation. So we need to carefully monitor the stimulation of your ovaries, which we call cycle monitoring. So let us say FSH starts on day 2, then you started antagonist on day 5, you're having daily injections, and at a certain point we start monitoring your cycle by doing ultrasound scan and blood tests. So the question is, what's the purpose of those monitoring ultrasound scans and monitoring blood tests? So there are 5 reasons for that. First reason is to ensure that you are not having LH surge during the stimulation. Let us say the pituitary should stay blocked, and your pituitary should not interfere with your cycle. And we monitor the cycle to ensure that your pituitary is staying blocked. It's not getting activated and not producing LH hormone, which is ovulation hormone, and to ensure that you're not going to ovulate during this stimulation. So that's why the first purpose of cycle monitoring, to ensure that you're not having all LH surge or ovulation hormone surge. So second purpose for the cycle monitoring is to check if your ovaries are responding to stimulation. When we say stimulation, we mean the FSH injection. So once you're having daily FSH injection, for example, let us say Gonalef or Purigon, one of those FSH injection. So we have to monitor to check if your ovaries actually registering the FSH, and if your ovary is responding to FSH. If your ovary is not responding to FSH, it may be due to a number of reasons. For example, you may not be giving injection correctly, or you may need a higher dose of FSH, which means that we may need to increase FSH dose. So there could be the various reasons. So this is why we have to monitor to find out whether you are responding to FSH injection, and as a result, if you are producing follicles and mature eggs. So the third reason for monitoring is to check your endometrium, which is the lining of the uterus where the implantation should take place. So during monitoring scans, we check the lining to make sure that in the thickness of the lining is normal and there isn't any fluid and there isn't any abnormalities like polyp or septum, which may impact your implantation. So this is the third reason, is to check the endometrium. Fourth reason for cycle monitoring is to check if the follicles are mature enough for the trigger injection. And so we need to know exact time when we should give you trigger injection. We shouldn't give trigger too early. If you do that, we get a lot of immature eggs. If we shouldn't give trigger too late, which means the follicles become too large, and eggs inside the follicles may become over matured and degenerate. So that's why we have to give FSH exact right time. For that, we need to monitor by ultrasound scan and blood test. So now fifth reason for cycle monitoring is to check if you are having any problems during the stimulation, any emotional problems, any medical problems, any logistical problems, or anything happening in terms of your medical treatment, which may impact your IVF treatment cycle. If that is the case, we need to find out and try and help you. So if this is the case, of course, you need to inform the nurses and doctors during cycle monitoring so that the issues can be addressed quickly. So these are 5 reasons for cycle monitoring. Okay, so now we know why we do cycle monitoring. So now let us discuss how do we monitor the cycle. Okay, so first question is when actually cycle monitoring starts. Um, Generally, cycle monitoring starts from the day 1 of cycle. So monitoring means that you will have a direct access to the clinic, and if you have any questions, you can discuss with your clinic team. So and technically you may not do ultrasound scan and blood test, but you are actually still in the cycle, and your injections, how you're handling the injections, how you're handling overall the treatment cycle, these are monitored by just communicating with you. So technically cycle monitoring starts approximately from day 5. So first 5 days, the level of FSH in the blood increases gradually, starts stimulating ovaries. So usually you don't see a lot of response first 4 or 5 days, and hence there is no point of doing scan and blood test. From day 5 or day 6, depending on your specialist preference, cycle monitoring starts normally. So in cycle monitoring, 3 things happens. First thing is you have ultrasound scan. So you have transvaginal ultrasound scan. On ultrasound scan, sonographer will check ovaries and the uterus. In terms of ovaries, on each ovary, sonographer will check how many follicles you have. So follicles can be in different size. So they count total number of follicles. So first, and second is the size of each and every follicle. So normally sonographers measure the follicle in 3 different measurements, and they work out the volume of each follicle. And the third thing, they check the lining, endometrium, like we said, and measure the lining, thickness of the endometrium. We want the endometrium to be more than 7 millimeters in average. So, and the third thing is sonographers do is that they check for possible pathologies. They check if there is any pathology which may impact, which may cause difficulty with egg collection, and which may impact your implantation. Let us say if you have a large ovarian cyst, adhesions, if ovaries are really high, the sonographer will take a note and document and inform the specialist to be aware that there could be some possible difficulties with egg collection. And also sonographers will check if there is any endometrial polyp and any uterine fibroids, any sign of hydrosalpinx. These are the pathologies which may reduce your implantation. So this is a part of cycle monitoring. So next thing happens. So as we said, we do three things in cycle monitoring. Let us say if you have a cycle monitoring on day 5, you have ultrasound scan. Second thing is you have blood tests. On the blood test, we check hormone levels. So we specifically check LH levels, LH hormone, it's a luteinizing hormone. The reason for that is we want LH to stay very low. So if LH is low, that's a good sign, which means antagonist injection is working. It is suppressing your pituitary gland. If your LH starts surging on day 5, that indicates this antagonist may not be as effective, and we have to check if you are actually surging through and if you are going to ovulate before we do egg collection. So second hormone we check is estradiol levels. The reason for checking estradiol is to check if to answer this question: are FSH working? um, our FSH injections are working. So because the estradiol is produced from growing follicles, the higher the level of estradiol is the higher the ovarian stimulation. So if you are having very low estradiol, that indicates your ovaries is not responding to stimulation. So if you're having very high estradiol, that indicates your ovaries are overstimulating to FSH. So accordingly, we can adjust the dose of FSH. If you're over responding to FSH, the dose of FSH can be brought down, or if follicles are mature enough, you may have a trigger. So if you're having lower stimulation, then FSH dose can be increased. And the third hormone we test as a part of cycle monitoring is the progesterone levels. So the only source for the progesterone is ovulated follicle. So sometimes you may have a luteinization of the unovulated follicle, which can produce low level of progesterone, but high level of progesterone normally produced from corpus luteum, which is ovulated follicle. So we want progesterone levels to stay very low. If it is very high, then we should try and find out why progesterone level is increased. Is it because antagonist is not working and your pituitary become active? So here we want LH to be very low, progesterone to be low, and we want estradiol to gradually increase every time we do cycle monitoring bloods. So normally, once you start the monitoring of the cycle, maybe you start on day 5, day 6, or day 7. So then then you should monitor cycle until you do the trigger. So usually you can do every other day. Let us say if you had a cycle monitoring scan and blood test on Monday, the next cycle monitoring scan will be done on Wednesday, then Friday. So you keep having the cycle monitoring scans until we answer this question, which is, are follicles are mature enough for trigger injection? So once follicles are mature enough for trigger injection, once we ensure that LH is low, progesterone is low, and estradiol is in optimal state, then we give a trigger injection, then cycle monitoring stops, and after trigger injection, all injections stop. So this is cycle monitoring. So as we said, in part of cycle monitoring, we do three things. One is ultrasound scan, second blood test, and the third thing is a review by your treating team, your specialist, or fertility nurse, so depending on the unit. Someone will review these results and make a clinical decision. So on the base of these results, they can make one of few decisions. One, they may say, we will continue the stimulation and do repeat blood test and scan after a couple of days. Or if you're ready for trigger, they will decide to give you trigger and plan a collection. Or if you're having very poor response, if you search through, then cycle may need to be canceled, which is not common, which is very rare. Okay, so this is why you need cycle monitoring, and so how we do the monitoring. So now, I will discuss how we actually we keep a track of it. we track your cycle by using IVF folliculogram. So all the units have their own version of folliculogram, which has got date, which has a section for the blood test, then medications you're using, then ultrasound scan of the ovaries and endometrium, and the plan. If you had IVF treatment cycle, you might have seen your cycle monitoring page. By looking on one single page, you can tell a lot about how your cycle is going, or went, if you had a previous IVF cycle, if you're looking at historical record. So that's a very important piece of document, information, source of information for doctors to monitor your cycle and make a decision. So yeah, so overall, this is end of my presentation for cycle monitoring.
Thank you so much, Doc, for that. And now I have here just one question. How many ultrasound scans do you need during monitoring?
Yeah, so generally you need a couple of ultrasound scan normally. Some patients may need only one scan because, let us say, if patient has a scan on day 8 or day 9, and the follicles may be already mature enough, and on the base of that scan and blood test, the specialist may be able to make a decision to trigger. So minimum one scan, and some scans, some patients need more number of scans. Average maybe 2 ultrasound scan is common. And some patients may need more, 3, 4, 5, 6 ultrasound scans, because some patients may respond very slow at the beginning, and then you have to stimulate longer. Let us say if you stimulate 14, 15, 16 days, then you should monitor the cycle by appropriate scans and blood tests. So there isn't any limit, minimum or maximum limit, but average, I would say 2 to 3 scans and blood tests, and it can range from 1 to maybe 6, 7 blood tests and scans.
All right, thank you so much for clarifying that, Doc. Now, to everybody who's watching right now, and for those who will be watching the replay later, go ahead and send in still your questions in our social media accounts. You may also send a direct message to our official Facebook page at Fertile Official. And then again, would like to have everybody's attention to the screen. Let's all watch this. We'll take a quick short break. And of course, IVF Navigator is your fertility companion, providing detailed interactive information about all aspects of IVF. And upon launching of the IVF Navigator, you can download it for free, of course, on your Apple App Store or Google Play. Claim your 15-day free trial of IVF Navigator and all of its features. Follow the simple and easy steps to start right away. Thank you once again to everybody. And of course, you can go ahead and visit our official Facebook page. That is, of course, at Fertile Official, and our official website, which is ivf-navigator.com, for more information. We will see you again all tomorrow at, of course, the step 26 and 27, which is the low stimulation, and also, of course, the high stimulation, if I'm not mistaken.
Yes, so we will discuss the difference between a low ovarian response to stimulation and high ovarian response to stimulation, and how we manage these clinical scenarios.
All right.
Yeah,
Thank you so much,
yeah,
Doc.
thanks everyone for joining today's live stream, and we'll catch you tomorrow. Thank you.
Thank you, everybody. Enjoy the rest of the day. We'll see you again tomorrow.
Thank you. Thank you.